just like last. Everyone ready? Everybody ready? Good afternoon, everyone. I'm Darrell Shoemaker with Communications for the City of Rapid City. I want to welcome everyone here today from the Rapid City and area media, as well as those who are viewing over the various streaming of the media outlets and also on our city site as well. Today we're here to talk about the coronavirus and the impacts, the work that's being done locally, the efforts being done at Monument Health, the efforts being done at the City of Rapid City through some of the different facilities to take some initial precautions, and want to share that information with you today. So to kind of give you a little bit of a speaking order, first we'll start off with some perspectives from the city through Mayor Steve Allender. We will then have discussion from our Rapid City Pennington County Emergency Management Director, Dustin Willett. We also have then some brief presentations from what we're doing at some of the city facilities. That would include Patrick Dame from Rapid City Regional Airport. We have Craig Baltzer here from Rushmore Plaza Civic Center, and we have Terry Davis here from the Rapid City Public Library, again, just to kind of share a little bit of what the city facilities are doing on their end to take some initial precautions. We also have with us today to provide a little bit of the plan from Monument Health, some of the important messaging coming out of Monument Health that the general public should take heed of. We have with us today from the Director of Infection and Prevention and Control, Ty White, and Vice President of Medical Affairs, Dr. Shankar Kura. Also in the audience, available for questions afterwards, or during the press conference, we have Police Chief Carl Jegris, we have Fire Chief Rod Seals here, and we have Pennington County Sheriff Kevin Tome. So with that, again, we'll begin here with Mayor Steve Allender.
Thanks, everyone. You know, they put the least helpful speakers up first, and that'll be no exception today. I'm just going to talk to you a little bit about city services and what we plan on doing around city facilities. First of all, whatever happens with this virus, whatever the future holds for this virus, city services will continue, and especially the city services that will be guaranteed are the production and delivery of water, the sewer system, the wastewater treatment facility, the solid waste facility and the garbage collection, and public safety, and that goes for city and county also. These are all, although they are city utilities and city services, they are all very important components in public safety. So why I'm saying that is to tell you that there's really doesn't seem to be any reason for you to go out and buy all the bottled water you can get. You're going to have safe drinking water throughout the duration of this and future outbreaks. And don't panic. I'm just begging the people of Rapid City and Pennington County, just don't panic. There are rumors that swill around at this point in time. I heard one 5 seconds inside the door today, which is not true. And so just be calm, check your news sources, stick to the local news as far as any closings or changes to schedules or anything like that. Panic begets panic. And if you're in the shopping center buying milk and butter and you see a near riot over by the toilet paper aisle, it doesn't mean you need additional toilet paper. And please don't rob average everyday citizens in the future from buying the basic needs that they need for their own household hygiene. There is a situation where this irrational worry about yourself and your own survival can cause harm to the greater community. And I think this is the time when we're being pounded by various sources telling us how bad things are. This is the time for us to exercise calm and think about the bigger picture, which is our neighbors and our families as well. This will be at least a weekly assessment by the various organizations involved, if not a daily assessment. So there's no reason today to stop living your life. Go to the store, go to the movie, go shopping, go for a drive in the hills, do everything you normally do with some exceptions. And I think the rest of the folks here will be talking about some practices. As far as city facilities go, there's a realization that we have to take care of what's in our immediate area around us, our immediate work groups. We have to define which work areas are open to the public and which are only for employees. And I think it's appropriate for us to, for the short to midterm here, to discontinue some of the practices such as shaking hands and that close personal contact with a variety of people from around the community. We can still be together without doing that. And for goodness sakes, don't show your pictures of your grandkids by passing your telephone around to everyone in the office. What a perfect way to spread germs. Virus or not, that's a disgusting habit. Employees with symptoms should be sent home. This is from the City Hall, city facility perspective. There is, whether it's work ethic or fear of using sick leave days or whatever the case is, when supervisors or other employees spot employees who are sick, those folks need to be sent home. We are discussing now, but have not yet implemented, a travel limitation to reduce our exposure from with city employees to networks of other city, county, or federal employees. And we're instituting today some custodial changes, which is going to slack off a little bit on the vacuuming and concentrate more on the surface and knob and handle part of our facilities, with a focus on public areas as a #1 priority. So these are just some of the things that we've come up with today that we can do locally in our own offices and our own city facilities that will keep us at a better position where we're not recklessly spreading germs. And now for the real experts.
Certainly well said, Mayor Allender. Dustin Willett, the Director of Emergency Management for Rapid City and Pennington County. Emergency management's role in the community is more focused on large-scale capabilities, not necessarily a specific threat or a specific pathogen. Infectious disease is certainly one of those threats that our office looks at, plans for, and develops capabilities for. What we're doing right now and what we'll be doing in the foreseeable future is acting basically as an information clearinghouse so that stakeholder groups across the whole community, so not just government, but private sector, public or private nonprofits, non-governmental organizations, faith-based organizations, all those things that make up a community that we term the whole community. We provide a clearinghouse so that those organizations can understand what's happening, what other organizations are going through, what they're seeing, and then what other organizations have already done or are planning to do. The intent there is to build what we call a common operating picture, so that everybody kind of knows what everybody else is doing and what resources and efforts exist in a community. The intent is to increase efficiencies and avoid duplication of effort. So we only have so many resources on any given day for any given thing, and one of the things that our office really tries to do is make sure that the resources that we do have are being coordinated amongst all the different organizations so that those resources are used appropriately and efficiently. To do that, we are on conference calls, as Mayor Allender alluded to, daily. We're talking with our partners at Health and Human Services at a federal level, at a local level, especially our partners with the South Dakota Department of Health, as well as the Centers for Disease Control and Prevention. The specific plans that could potentially be operationalized in the future, it's certainly not something we're doing now, but we look at our governments in the area brushed up on their continuity of government planning. Do we know what that looks like? Are we well positioned to make sure that government continues to deliver the services to the community that it needs to deliver? And I think Mayor Allender's opening highlighted the fact that that's certainly the case, and that certainly is happening. And then the other big piece that our office gets involved with, and again, it's not a single effort. We do it in combination with our partners and our stakeholders, in this case primarily the Department of Health. But we operate points of dispensation. So should there ever be any medical countermeasures that are designed or encouraged to be released to the public, we work with the Department of Health to make sure that operation occurs. So that's where emergency management currently is at.
Well, thanks for having me speak today. I would like to say that probably from the different venue buildings that are going to be speaking today, myself, the airport, the library, probably going to say a lot of the same kinds of things. So I'm glad I get to go first and break that. First of all, I want you to know from the Civic Center, currently there has been no events canceled because of the coronavirus. I do expect that could possibly change in the future, and people should pay attention, because we will let that be known publicly when that happens. But so far, none from the Civic Center have been canceled. So we're going about business as normal. When I say we're going about business as normal, we do disinfect every doorknob, every handrail, every flat surface, probably 4 times as much as we used to. When I say business as normal, you see these hand sanitizing stations all over the venue, or a bottle of Purell up on some counter somewhere more often. And we're asking folks to be responsible to their own personal hygiene and wash their hands, use our bathrooms, or use these stations as much as possible. We are encouraging our staff and telling them to go home when they are seen as showing visible signs of being sick. But we're also going to encourage, and you'll never hear an arena manager speak like this, but if the general public, if you're feeling sick, that event is not that important, please stay home. Let's have some personal responsibility there. And that gets difficult when you have a child performing for the first time in their life at the Civic Center for an event. But if you're feeling sick, it's probably best to stay home. And if we practice those kinds of personal responsibilities, I think that this would be a lot easier for everybody to go through. Again, the Civic Center is going about business as normal, but obviously normal has changed a little bit, and we are doing some other things. So I'll be available for questions afterwards. I'll let the next one go.
Good afternoon. Terry Davis, Rapid City Library. Our 2 library locations average 1,200 visitors a day, and with that number coming in the doors, it is very likely that at any given time somebody is going to have some kind of illness or other. So for that reason, for many years we have provided hand sanitizer stations similar to this throughout the locations. In addition to that, we also, with the current situation, are providing information from the CDC regarding hand washing, how to minimize the spread of germs, etc. We are also, as Craig mentioned, putting real concerted efforts to wiping down every surface. In our case, we have computers that are heavily used by members of the public, laptops that are checked out by members of the public. We're sanitizing those, all the flat surfaces, all the doorknobs, handrails, etc., as Craig mentioned, and paying particular attention to the restrooms. And as the mayor and Craig both mentioned, if staff are feeling unwell, they are to stay home. If that South Dakota work ethic takes over and they try to come to work anyway and are symptomatic, we will send them home. If individuals prefer not to come to visit the library because of the number of people who are there, please understand that you can still use the library services. We have a significant digital presence. You can use ebooks, e-audios, streaming videos, e-magazines, etc. And if you need any help with that, please call us and our staff will help you get that set up. At the downtown library, we also have a drive-through window. If you want to drop off or pick up materials, you can certainly do that. And our library at General Beadle School, that operates on a limited number of hours. We do plan to keep that open right now. However, the opening of that facility is entirely dependent upon the school district. Thank you.
Good afternoon, Patrick Dame with the Rapid City Regional Airport. So obviously with the airport being a major gateway into the community, we've been addressing this with our board as we did yesterday, but also started more of a proactive process on this and meeting with our cleaning contractors who do this and working with them on increasing the sanitation side of that. So based on that, as I mentioned, we've increased the sanitation, spraying down flat surfaces with a product called Vital Oxide on that, and then working through, we've posted signs on the mirrors again to try and encourage folks to wash their hands, the proper way to wash their hands. We're considering right now and discussing any need for additional staffing on overnights to continue doing cleaning and sanitation on those surfaces. We're working with the city, county, and state officials on that. Our plans we do have a plan in our emergency plan that requires us to coordinate with the local medical and also the CDC as needs would arrive from that path. We're also passing along any emergency management materials that we get to our local carriers that are here. I've also had an opportunity to get some information from the Transportation Security Administration, and much like us with our staff, we're working to try and keep the staff safe, as are they, using proper protection equipment for the TSA personnel that are also working with people and engaging with folks on a daily basis. And then obviously encouraging people to wash their hands and be as sanitary as they possibly can around there. So thank you.
Do apologize, I do have a correction here representing Monument Health. I mentioned earlier is Dr. Kura, but also we have Jill Tice, who's the Vice President for Quality, Safety, and Risk Management. So to share insights from Monument Health, I'll turn it over to you folks. Thanks.
Hello. Our hearts go out to the family members who have been affected by the COVID-19 across the world. We know that locally we have a family who is also experiencing effects from COVID-19, and our hearts go out to them as well. The patient was not a patient of Monument Health. Avera has confirmed that the patient was being cared for in an Avera Health location. Monument Health remains ready to combat the COVID-19 virus, meet the healthcare needs of our patients while protecting our caregivers and physicians from the virus. Physicians and caregivers have been planning for weeks as to how we will approach operationally and medically the COVID virus. They've been meeting twice a day to develop operational plans that are communicated to our frontline caregivers to help protect our patients and community. We're making sure everybody knows what to do. We're managing our supplies, and we're preparing for every contingency. Our teams are in regular communication with the South Dakota Department of Health, who also manages the testing capabilities. We also, on a daily basis, review information and guidance coming from the Centers for Disease Control and implement those as appropriate. A webpage on the monumenthealth.health website includes daily updates as provided by the Centers for Disease Control. Monument Health reminds our community members to remain calm, practice good hand hygiene, stay home if you're sick. If people are experiencing, or if you are experiencing a fever, cough, shortness of breath, reach out to your primary care provider, contact one of our urgent cares or emergency department. Thank you.
So time for questions and answers. So if you have a question, I guess just go ahead and direct the question to the particular individual. And if there's any follow-ups, share that as well. Thank you.
Good afternoon. My name is Shankar Kura. I'm the Vice President of Medical Affairs at Monument Health. I'm an internist by training. To answer your question, if we have a case, we have a plan to isolate the case in the hospital. So as far as affecting visitors and patients, it would only apply to visiting that patient because that patient will be isolated. So the usual precautions would apply, but we wouldn't have any other changes unless some new information comes to light from CDC. Mm-hmm. Yes, so it will cover all coronaviruses, even the novel coronavirus that is the COVID-19. So yeah, these hand sanitizers and the ones we use, the alcohol PDI wipes, they will cover all coronaviruses, including COVID-19. Yes, we have a plan. We have a large team that's developed a plan. We have a plan that is tiered. So initially, if there were just a single case, then we would deal with that. If we exceeded a number, then we would actually have an entire unit designated just for that purpose. So we do have a plan to, if we ever are in an unfortunate situation of having large numbers, to be able to deal with that.
Good question. Right now, we have not seen a necessary noticeable impact that is there. We haven't seen cancellations of flights as a result of that. In terms of the airlines, for those of you who are likely mileage holders and stuff, you've likely gotten recent notifications about the airline and working through to clean, again, work through the same process of sterilizing their aircraft and their facilities that are there. Obviously there are some international pullbacks with flights that are going on. That could work either way on the domestic side, whether or not they increase domestic flying as a result of the changes that are there, or, depending on how much the local U.S. position is on that, they could also pull back. So from that side, we really don't have a solid answer going forward as to what we're kind of expecting either side of that. whether that's pulling back or increasing. Again, I would make the same comment that Craig also made, though, too, is that, if you're feeling symptoms, if you're feeling sick, the last thing you probably want to do is come out, get in a aircraft and fly off. That might be a time to consider canceling your trip as well. Right now, we do not have the intent to be reviewing passengers from that standpoint. Again, we'll continue to work with the CDC on that, and as advisories come out from them, we would implement what was needed.
Absolutely. And please understand we're not at that point yet. So, and when we talk about pandemic, we're talking about severity in cases on a global perspective. While the virus is the virus, how we respond in Rapid City and Pennington County is not necessarily how we respond in China or Italy or even California or New York. We have our own idiosyncrasies in our area, our own resources, and our own challenges and strengths that we play on in these types of things. In terms of the point of suspension, so that process is, the foundation for that process is to dispense medical countermeasures from the Strategic National Stockpile. So there are stockpiles of medications and medical supplies around the country where should the Surgeon General or the Health Department deem that these things are necessary to be distributed in communities, or if a community makes a request that is validated up that chain, emergency management is tasked with the logistical side of distributing those supplies. So emergency management is not the decision maker on whether or not those supplies are accessed or whether those supplies are distributed or not. Once the decision is made to distribute supplies in that process, emergency management is responsible for the logistical side of making that happen. So we work hand in hand with multiple partners, most especially the South Dakota Department of Health that provides medical oversight to that. Certainly our partners with Monument Health are involved with that. Even our nurses in Rapid City area schools are involved in that planning. So there's lots of pieces to that. In terms of what it would look like for anything related to COVID-19, the question is, are there supplies in the existing national stockpile that would be leveraged against that, or would there be something new coming out that they are, if there's something new that needs to be distributed, or the decision is made to distribute that widely to communities, that point of dispension model is most likely what would be utilized to do that. And again, emergency management's role is just in facilitating the logistics of those operations. Does that answer your question? Okay. So I would say that people should prepare, and I would stop the sentence there. I wouldn't add quarantine, I wouldn't add pandemic, I wouldn't add flood, I wouldn't add fire, I wouldn't add tornado. I would say that people should prepare. We should all have some measure of self-reliance. Our office advocates for a 3-day supply of medication, food, water. Now, would 3 days be adequate in certain situations? No, and it'd be more than adequate in others. So I would absolutely promote, and our office continually promotes, it's one of the messages that we really try to drive home is individuals and organizations, churches, schools, anything should prepare to be self-reliant for a minimum of 3 days. And that includes, again, prescription medications, water, food, necessities, baby formula, diapers. certainly not to monopolize the conversation, but I can speak to that briefly. So again, emergency management's role in the community oftentimes is that clearinghouse of information. We have great relationships with both Rapid City area schools as well as all of the other school districts within Pennington County, and then our higher education as well, Western Dakota Tech School of Mines, and our SDSU and USD affiliates that we have in town as well. We are always in conversation and communication with those folks. So the threat affects different people in different ways, regardless of what that threat is. So again, solutions that might work for a government organization might not be the same solutions that work for a school district, and an elementary school is different than higher education. But to answer your question as succinctly as possible, yes, those conversations and that communication is absolutely occurring.
As far as I can tell at this point, it's going to be a periodic touching base internally within our work groups and externally with some of the other organizations such as Emergency Management, Monument Health, and to see how this particular pandemic is developing. And just imagine it's going to be much different in 2 weeks than it is today. And so, therefore, it may require a different plan. So when we put something out through social media to the public or through a press release, it will be based on the latest assessment that generally the consensus of the group feels most appropriate.
So one item for the public who might be viewing in, that one of the great sources of information that we're certainly sharing on our website, but to get updates, information, have a Q&A, is the Monument Health information site. That would be www.monument.health/COVID, COVID. So again, that'd be a good site for people to check. They have links to Centers for Disease Control and the State Department of Health. And again, if there's no other questions, we appreciate the time the media has taken today to stream this to their viewers and readers. And that concludes today's press conference. Thank you.